Congratulations, Samir sir, and thank you for this wonderful oration. It was indeed a Bollywood stuff. So whenever you are around, we expect that. So moving on in the same vein, how's the Josh? How's the Josh? Piche, how's the Josh? And is there fire within? Okay, so moving on. If you have fire within, our dynamic secretary Shikha is going to take vasculitis. Yes?
Let's see.
Yeah, okay.
No, this is fine.
कोणते बघा मॅडम हां ते त्याला हूक आहे बघा ते इथे कोणतं नाव आहे मॅडम
Please lock this. So we had an excellent oration by Samir sir now on a very specialized developmental pediatrics. Moving on to another very specialized field, and we are encouraged by such orations where we are working in a specialized area. So hopefully I'll have some concentration here. Okay, so we'll see some puzzles to patterns in these cases. I'll request everyone to please settle down. Okay, so this first case, I like to have the attention of the audience. She is a 3-year-old girl child, complains of some painful swelling on the forehead and along with some red spots on the leg. She comes to you first day, some antihistaminics are given considering that there might be some allergic rash here. On day 2, this child develops some pain on the right knee and lesion on the hand along with swelling on the hand. On day 3, she has rash which extends to bilateral legs and the buttocks also. So do we have the guesses what the diagnosis is here? Henoch-Schönlein purpura. So we did a first line investigation, a CBC was done, essentially normal, just a mild rise in C-reactive protein, and we know this is a spotter. So these are the rash, this is the limb rash. So we are seeing something which is Henoch-Schönlein purpura, IgA vasculitis, a small vessel vasculitis, easy spotter. Now we have another case, 9-year-old boy, fever for 8 days, and this child has lesions, tender lesions over the lower limbs. There's some appetite and weight loss as well, which the parent complains for the last few days. And on the first line investigations, we have anemia, a high TLC with a neutropredominance. The ESR and C-reactive protein both are very high. So can we have just a spot diagnosis for this case also? So we have something which has fever and nodules in the legs. So it can vast range from inflammation to infection, anything can be considered in this patient. So these are some lesions which actually, if I need this, okay. So these are the lesions of the child which was there. So this is what we see, that there is something which is on fire. And now we need to see how we fight the fire that is happening within. So if it is inflammatory or vascularity disorder, how we actually in an OPD or IPD practice, at what time would you consider to think that there might be a vasculitic disorder in this child? When do you suspect? So sometimes we always think that vasculitis means chronic disease hoga, bahut prolonged history hogi. So now we see in the first case itself, day 1, acute history as well, we can consider the child to have vasculitis. Of course, sick child hai, then it might be a prolonged history as well. and it might be a sick-looking child. So vasculitis need not be always a prolonged history or a chronic history. What kind of rash can you consider to be vasculitis? Is there a specific kind of rash? Do the rash need to be always itchy? Like we say urticarial vasculitis. The urticarial vasculitis are actually not very itchy vasculitis like we see in a other kind of allergic rash. So here we have something which may be more of burning sensation. It may be a painless rash like we saw in case 1 where it was IgA vasculitis or Henoch-Schönlein purpura. It can be a very tender, painful nodule like erythema nodosum, something like that. So it can be painful and tender. Most commonly, lower limbs are more commonly involved, but upper limbs can also get involved. So if it's a sick patient, sometimes when there is unexplained, so rheumatology is always like कुछ नहीं समझ आ रहा है, तो that point सोचो कि कुछ rheumatological हो सकता है. So unexplained fever, weight loss, and vasculitis in certain diseases, they can involve all, the multitude of vessels can get involved, and depending on which organ it is involving, accordingly it can give signs and symptoms. So we already saw some certain signs and symptoms in the skin. It can have arthritis, arthralgia, myositis, myalgia. It can even present with just hypertension, which is unexplained. It can present with mononeuritis multiplex. So depending on what organ is involved, the symptoms can be there. So like in the first case we discussed, it can be infection to inflammation. So we always need to rule out the commoner causes. The commoner causes will be a big list. So we'll rule out infections. If there are any infections which are sinister to that particular case, then we need to rule that out. We ruled out malignancies in certain cases. We rule out if the child has taken some drug and it is a drug-related reaction which is happening. And once those things pertaining to that case is ruled out, then we do further investigations. Remember, when you're doing even the first line investigation, in any case, each investigation is the hero itself or the protagonist who can tell you what the disease might be further. So if we do a CBC, in case of vasculitis, it's usually a very high TLC with a neutropredominance. You do the first line investigations, just a baseline acute phase reactants, ESR or CRP, both may be high in case of vasculitis. Urine analysis done may show proteinuria, hematuria, casts. And a simple, when we do a liver function, we do the protein. So there might be a albumin globulin ratio reversal. Depending on what you are going ahead, you create a differential diagnosis of what kind of vasculitis you are thinking. So it may be a small vessel, medium vessel or large vessel. So we first see there are unexplained signs and symptoms. We suspect a vasculitic syndrome and then we identify the vessel size. So what are these diseases actually? Large vessel, small vessel, large vessel, medium vessel and small vessel vasculitis. Large vessel we know Takayasu arteritis is one of the commonest ones that is in large vessel vasculitis involving the aorta and its major branches. Then if it is involving the organal branches, then it is medium vessel vasculitis, polyarteritis nodosa and Kawasaki disease. We all know it's a medium vessel vasculitis and we all see in our OPD, IPD practices. Other small vessel vasculitis, IgA vasculitis, Henoch-Schönlein purpura is another common immune complex small vessel vasculitis, and ANCA associated small vessel vasculitis like GPA or EGP can happen. So we need to identify the pattern. In the last lecture, you learned about the patterns and you should not be in pattern. But here when you're seeing these patients, you need to identify what is the pattern and accordingly so that you can narrow down your investigations and do not investigate unnecessarily here. So here we have in again, small vessel vasculitis, you can see palpable purpura like we saw. In a medium vessel vasculitis, there can be painful nodules, there can be there. If it is involving the renal vessels, there can be hematuria, there can be CAS or proteinuria. And a large vessel vasculitis, they can present more commonly like hypertension or symptoms of infarction. Another thing, when to order ANCA? Do you order ANCA in all cases? Supposedly, if you are seeing a child with hypertension and unexplained, your thought process is it might be a Takayasu arteritis. We do not order ANCA, though there are certain specific things. First is first level investigation, which is suggesting that there might be a vasculitic disorder. Then you're thinking that it is a small vessel vasculitis. It is then that you order ANCA. So you have to know the symptoms which can be caused. So pulmonary renal syndrome, or if there is a chronic non-resolving sinusitis, or there are certain skin manifestations with systemic features where you order an ANCA test. An ANCA should always be ordered by an ELISA method. PR3 ANCA, MPO ANCA, specific ELISA method should be ordered. If you are thinking a large vessel vasculitis, then comes the role of imaging. So large vessels, usually large to medium vessels can be identified on angiography. You do a CT angio or an MR angio. Even the initial stages, ultrasound Doppler helps you identify whether there is any blockage or not. And then you further, of course, confirm your diagnosis with the high-end investigation. Ultimately, if there is any possibility of biopsy of the lesion that you see, that's the best way to prove the condition that it is a vasculitis, because they will show the neutrophilic infiltrate in the vessel wall in case of vasculitis. So that's what you need to fix, the last piece of the puzzle to finally identify what the case is, and you need to identify the pattern again here in every disease. So if we see this 9-year-old child who was there in the second case, the child had fever, the child had some tender lower limb nodular rash. It can be a vast, tuberculosis is one of the commonest differential erythema nodosum like lesions can happen. So of course this child was investigated. First line investigation, like I already showed a neutrophil predominance, showed high CRP, high ESR. Then to rule out infection, a blood culture was done, which was negative. A urine routine was done, which showed some RBCs, 30 to 35 RBCs per hyperfil. But again, there were no symptoms of UTI and the culture was negative. Tuberculosis was also ruled out in this patient because all other tests pertaining to tuberculosis was negative. So at this point of time, you may consider that this child may have an inflammatory disorder. So now we'll go back to that again, pattern recognition, and see where does this child fit in. So if you see, this child has a cutaneous nodule, so those nodules, painful nodules were present, and there was hematuria casts which was present in the urine. So we understand that we are dealing with something which may be more common, which may be like a medium vessel vasculitis. So you need not go ahead and do a CT angio or something like this in this child. What you need, it's a skin. It's a very easy thing to biopsy. So you do a biopsy and you finally see that there are neutrophils which are infiltrating the vessel wall, and it is polyarteritis nodosa. This child actually had already done a TFT, a complement, an ANA blot, rheumatoid factor, anti-CCP, and even a bone marrow was done in this child. So now we understand there are certain tests which are not required, and we really need to figure out what is important. Certain tests, now parents also Google fever, joint pain, what to do, anti-CCP. So they will do that and come, which we cannot help. But what is in our hands where we can use their resources correctly and the correct tests can be done in that child should be done. So this is an approach which can be taken with any child. First, rule out the mimics. Think of a vasculitic disorder if you see if it falls in that category. Then classify what you are thinking, whether you are thinking a small, medium or large vessel, and then accordingly investigate. So when we hear the hooves, we always think of the horses, but you cannot miss the zebra, because one can be a zebra and that has to be identified. So coming to the challenges in management. So I have not covered too much in the management part, because each disease in vasculitis, whatever the diseases are, there are different kind of management. So always it's said that only steroids, so not only steroids play a role. In sick diseases, of course, sick patients, steroid play a major role, but whenever we start steroid, we have to know that we have to start steroid sparing agent depending on the duration of steroid that is required. So each disease has different kind of management. We also need to understand that whether we are dealing with the child in an active inflammatory state or we are dealing the aftermath of that vasculitic disorder. If there is just a blockage and the active inflammation is not there, then the treatment patterns would be different. Okay, some common vasculitis and the tidbits about that. So IgA vasculitis, I'm sure everybody, last few months there have been quite a few cases of IgA vasculitis or Henoch-Schönlein purpura, and everybody must have seen in their OPDs. We very commonly know that they may present with rash, which is not painful. They may sometimes present with pain abdomen, and they can have sometimes arthritis. But remember, we need to undress this child and see, because they can have balanoposthitis and balanitis, and this is very important thing to figure out whether the child has or not, because it also guides our treatment for that child. So initial stage, it's always supportive. NSAIDs, if required at all, then that needs to be given. A good counseling of the parents is required. For them to see a young child to have a rash which is just few initially and that's progressing, involving the whole lower limb, buttocks, it's very uneasy for the parents. So we need to counsel them and of course monitor each time when they visit us. When to use steroids? Do we use steroid in every case of henoch-Schönlein purpura who lands up in our OPD? No, because steroid using initially has not been shown that it will prevent a renal complication. So you need to understand that only rash is never indication. Only just swelling, subcutaneous swelling is never an indication to use steroid in a case of henoch-Schönlein purpura or IgA vasculitis. It is only when the child is having significant GI bleeding, that is the time we use. Or if the child is having balanitis, balanoposthitis, then we need to use steroid. Again, if you are using steroid, endpoints should be defined. How much and till when? कुछ भी कम भी दिया तो भी काम नहीं करेगा, ज़्यादा दिया तो side effects करेगा. So you need to understand that. So how much and how long? 1 to 2 milligram per kg for 2 weeks and followed by taper over the next 4 weeks. So this is at least that much has to be given. What is most important in case of henoch-Schönlein purpura? What one test should be done for that child of henoch-Schönlein purpura? Urine routine, very good. So urine routine examination is one that we need to advise the child that this has to be done, and parents are always very happy to do urine because it doesn't need a blood prick. So, but you need to tell that it has to be done for total of 6 months, and it all depends, the frequency depends on how the first and second urines are. If they are normal, then we do it fortnightly and then monthly, and at least till 6 months. Till 6 months, the chances of renal involvement are high, and kidneys are one who do not show symptoms in the initial stage till the creatinine start rising. So we need to identify those patients who have a kidney involvement early. Okay, another very common disorder, Kawasaki disease. We all know treatment, IVIG, 2 gram per kg, given over 12 to 18 hours. Aspirin, what is the dose that you use for aspirin of Kawasaki disease? Yeah, so initially what was recommended as 80 to 100 milligram per kg is not used now. It's 30 to 50 milligram per kg till the child is afebrile for 48 hours, and we shifted to 3 to 5 mkd, and it all depends on the echo findings how long you continue that aspirin. Another important thing in Kawasaki disease, very important to understand, is primary intensification. So it has been recommended that if a child has a cardiac involvement, if the echo shows before the treatment or immediately the first echo shows that there is a dilatation, or if a child is less than 6 months of age, that with IVIG, along with IVIG, a primary intensification of therapy should be done. That intensification can be infliximab or steroid depending on center to center, how is the affordability and everything has to be considered, or steroid or infliximab should be given with IVIG and aspirin in these two high risk cases. Dual antiplatelets, of course, if it's moderate or large aneurysms which the child is developing. Even if there is thrombus, there is no role of thrombolysis because the chances of intracranial bleed is very high. So usually antiplatelets and low molecular weight heparin is given so that the thrombus gradually lyses, and we need to control the inflammatory process. That's very important when we are treating Kawasaki disease. So just a few spotters, can anyone identify what this case is? So this is actually just henoch-Schönlein purpura. Vesiculobullous lesions, the bullous, hemorrhagic bullous henoch-Schönlein purpura or IgA vasculitis is one of the entities in which the child actually went on to develop a big bulla and a gangrene of that lesion, and that of course that lesion got infected. So these are the look and spot where we can identify the ear lobules, the hands and the limbs can get involved in henoch-Schönlein purpura, but they can have multiple kind of the vesiculobullous lesions can also happen. This we all know. Kawasaki disease. So this is important to again undress and examine. Why? Because Kawasaki disease, the peeling which we learn usually happens the end of second week. But you won't wait for a treatment or your diagnosis till the end of second weeks. But the periannual peeling can happen in the end of first week or the beginning of second week itself, where it helps us to confirm or think of the diagnosis of Kawasaki disease and treat accordingly. So it's important. So what does this child have? Anybody? Known case of vasculitis and now on follow-up having this portion. Yes, so the saddle nose deformity in an ANCA-associated vasculitis. So this is very important to tell that nasal cartilage can get involved. A timely treatment sometimes helps prevent certain complications, though not all. So this is on follow-up, you need to see, and the child may need a plastic surgery to correct this once she grows up. So this one I know, this is a child who presented with hypertension, and then of course the workup was done, and we can see the narrowing which is there in the descending aorta. And this is Takayasu arteritis, and the renal vessels are also blocked. So last case which I want to discuss is 9-year-old girl child from Nashik, well child, presented with just acute history of severe abdominal pain, acute onset nausea, decreased oral intake, and this is her 4 weeks of history where she was admitted, ileal resection and anastomosis was done because there was a perforation which was there. Okay, the drain was put. In the week 2, there was again feculent drainage. So again explored, again multiple necrotic perforated patches, another jejunal-ileal resection and anastomosis done, another 3rd week and again feculent discharge. So again third exploration was done, and there was perforation, 1 perforation in terminal ileum. So right limited hemicolectomy had to be done with this, with a jejunostomy. So the bowel which was there, only approximately 40 centimeters of bowel was left. So we see that a child who has recurrent bowel perforation, different anastomotic sites, different time intervals, without any evidence of obstruction in a previously well child. So I'll directly go to the diagnosis here because it was not easy for any one of us. The biopsy showed small to medium blood vessels showing neutrophilic rich inflammation suggestive of vasculitis. This is single organ vasculitis, isolated vasculitis of the gut. So what I mean to say, it's not all hunky-dory with vasculitis. It can be just IgA vasculitis, henoch-Schönlein purpura, OPD case, just counsel, do nothing, urine for 6 months, all settled. It can be something HSP which we saw with huge gangrenous lesions, and it can be an isolated vasculitis of the gut. So if Dr. Vibor is sitting in the audience, he knows about this case and how difficult it was to reach to a diagnosis of this case. So thank you so much. And I saved some time as an organizing secretary.
So you had the onus on you. Thank you, Shikha.
Sir?
I would invite the organizing chairperson, Felicity.
Yes, ma'am. No, ma'am. We do not use. Yes, only if there is arthritis which a child is developing, or there is very painful, sometimes the subcutaneous node lesions which they develop, they can be very painful. Only then, otherwise also not. Thank you.
So now it's time to scratch your brains. Yeah, quiz.
Thank you.
2 days we've been training you, we've been telling you things, now it's time we'll ask you questions. They are not on this syllabus. Okay. So, Dr. Jagruti, Dr. Amin will take over for the quiz session.
Good afternoon, everyone. So just as Sameer has awakened the Shah Rukh Khan and all of us, I would like to start with one SRK dialogue that I am convinced, मुझे ये यकीन हो गया है कि लाइफ में भी फिल्मों की तरह हैप्पी एंडिंग्स हुआ करते हैं, और जब तक एंडिंग हैप्पी ना हो तब तक ये समझो कि एंड हुआ ही नहीं है, क्योंकि पिक्चर अभी बाकी है मेरे दोस्त. So with that, we are going to basically kind of awaken you with this picture quiz, or snap quiz as we would like to call it. So I'm going to start with some instructions. It is an online quiz on your phones. So so hard that Sameer said that you should stay away from your phones, we are now going to ask you to look only into your phones. And attend this quiz with us on a Mentimeter app. So in your delegate link, I have just sent you a link on the delegates group. So please click on the Mentimeter link that was sent on the Navi MBCon delegates WhatsApp group. Are you all able to see the picture quiz poster? Yes? Can I have a change of slide here? Yeah, I can only do it. If you can't get through this link, then please point your phone on the screen and scan the QR code and click open. Okay, whoever who has not been able to click through the link that we provided on the delegates group, please click open by scanning the QR code which is seen here. You may also join by going to www.menti.com and entering this code. I hope everybody has got this. Yes? We are, of course, going to start with a trial question, so you know what is the format of this quiz. Amin and I will let you go through this. So what is the highlighted lesion? You have to basically click, okay? And in this first one, you might have to write submit, but in the rest of the question, once you click, it is done, okay? So we would like all people to try on this so that you know where to click. Am I with the audience on this? Yeah.
People are clicking. You can
I
continue
think people are
clicking.
still clicking, and obviously this is not a difficult question. This is surely cystic hygroma. So 94% of our elite crowd.
No. So trial
Sir, ये
chocolate.
trial question में trial chocolate.
Trial chocolate. Remember, the marks are inbuilt into the computer. We are not giving the marks. And it also depends on fastest finger first. So if you spend a lot of time analyzing, you may be correct, but you'll still lose valuable points. As fast as possible. Let's see if someone can do it in 1 second. It will show on your phones. It will not show on us who's done the fastest, but yes, it will be recorded as the highest number of points.
Vinay, Shikha has them. Okay.
Is everyone done?
So this is showing us that 95% have clicked cystic hygroma here. And that's the correct answer. Now here, the Mentimeter will prompt you to write your name and surname. And I would recommend that each one of us, whenever you get that prompt, please write your name and surname. Okay? If it doesn't, then the Mentimeter is naughty. And the naughty Menti is going to give you some Atrangi name, which you are going to be stuck with till the end of this session. So putting your name and surname will help us to identify you when you win a prize. And yes, there are exciting prizes and sweet treats waiting for you. And although the images are going to be seen on the big screen like this, you must look into your own mobile phones. Scroll down the image for multiple choice questions and click an answer before the timer runs out. I'm so happy 77 players are already ready. It is most important to answer correctly, friends, to get your points. But remember that it is also important to answer fast, because fastest fingers will fetch more points. And like I'm inspired by Nehal right now, said that kal tak jo kati thi himmat e sawal mein umra. Amin and I have been working on this for the past 2-3 weeks. That kal tak jo kati thi himmat e sawal mein umra. Kahin aaj ummeed e jawab mein guzar na jaye. So friends, just do this fast. Okay, so here we go. Fasten your seat belts. Set your eyes on your mobiles. On your mark, get set and go.
So the first question coming up, don't get misguided by what you see. 17-month-old child comes with inability to walk, irritability and bent legs. No supplements were taken. The investigations will show everything except raised PTH, low alkaline phosphatase, low phosphorus, low vitamin D.
The timer is running out.
Oh, 8 people missed it. So we have the right answer. It's low alkaline phosphatase. Go on to
We
the
go to
next
the
one.
next question.
Identify the syndrome. Next.
It's Morquio, Apert, Crozans, or Hunter syndrome.
Wow. So we have 35 people going for the right answer. It was a close differential with Crozons, but Aperts had that syndactyly and the body proportions are also involved. That's why all the 4 images needed to be seen.
So you have to look into the entire picture,
Yes.
right? The next one, here it goes.
Please read the words carefully. Preferred drug of choice for UTI prophylaxis in a 1-month-old child with this condition. So identify the condition in your minds and whether which one would be the best. Nitrofurantoin, chlorpromazine, amoxiclav or cephalexin.
बाजू वाले को बताओगे तो खुद का प्राइस जाएगा. So we have a
Wonderful.
divided house here,
Yeah.
sir.
So remember, it was a 1-month-old. That's why cephalexin was the right choice. That's according to our IAP guidelines as well.
Okay, and now with bated breath, till we get the scores.
So no points for identifying this gentleman. Who's he? Lionel Messi.
Ooh,
So Messi had a condition.
this is the
and
chocolate
was
question.
diagnosed in his childhood with a condition and was given some treatment for that. Can anybody guess that? Don't shout that way. Someone has to say it. Whom would you give the chocolates?
So Shikha can decide whom to give. Amrita, can you help Shikha?
So people who are at the back will have to come to the front to get more chocolates.
No, the people at the back. Shikha, you have to look into the back also.
Yeah, Shunal.
Shonal is there, okay. And so the top 10 scorers so far are, the excitement is building up.
Whoa.
So there is Latin, whoever is the name.
Who's Latin? Okay, don't tell us, don't tell us.
Okay, that is fastest. You're not supposed to play.
You're not supposed to play. Latin is out of contention.
Okay, so so far the top
Stop
10
playing.
scorers, the toppest scorer is Aishwarya Lachake. Lachake is the correct, Lachuke, sorry. Okay, let's clap. That's okay.
No, that's fine.
Okay. That's so generous, Dr. Shah.
I think we should stop love site also. I think I know who love site is.
No, but at least it's not somebody who's played the game before. Okay, so we
All
go
right, all
ahead
right.
with the next question.
Questions.
All players ready here? Okay. Answer fast to get more points. Look into your phone. This is an FDA-approved gene therapy for which disease? Is it sickle cell anemia, spinomuscular atrophy, Duchenne's muscular dystrophy, or Gaucher's? The timer is running out. Yes, and the time is up. Okay, so we have 38 people who have identified it as spinal muscular atrophy, and that is the correct answer. Zolgensma is the gene therapy, which is a one-time gene therapy to treat SMA less than 2 years of age by infusing a new working SMN neuron or gene in the body's motor neuron cells. It costs a whopping 16 crore rupees. Yes. But 9 crores भी तो गए
It's a
ना.
worldwide lottery, na? Worldwide lottery hai.
So we also have gene therapy coming in for sickle cell anemia. Cascavy. Ma'am will be able to tell us more about it. Yeah, CRISPR. And for DMT also we have Eleviris, which has come up. The next question goes. Okay. Answer fast to get more points. The classic triad of this condition includes all except delayed closure of cranial sutures, absent or hypoplastic clavicles, dental abnormalities, or mental retardation. This is a cute little kid having a very classic.
Stranger Things, if anybody's been following.
You're supposed to give in clues. Okay, so the correct answer here is D, mental retardation. Gaten Matarazzo in Stranger Things, as Amin prompted rightly, plays Dustin in this Netflix series. And in the first 2 seasons, he has no front teeth. And in the 3rd season, they show him with a denture. So this is to create awareness about cleidocranial dysplasia. This is a condition when classically you would have absent or hypoplastic clavicles and delayed closure of cranial sutures and dental abnormalities.
In fact,
but these children are normal. They are not having a mental retardation.
He uses his power to go through small areas. He just dislocates his shoulders and goes through.
Okay. Be ready for this next question. A 3-month-old child with seizures and recurrent respiratory infection comes to you. What would you suspect if this sign, which is seen in the right hemithorax, is not seen in this patient? The options are Otahara syndrome, Digeorge syndrome, cystic fibrosis, and congenital hypopituitarism. I'm sure this is a giveaway to everyone.
Wow.
Woo. So we have 43 people answering correctly as Digeorge syndrome. This is a triad of conotruncal cardiac abnormalities, hypoplastic or absent thymus, and hypocalcemia because of parathyroid hypoplasia, giving rise to seizures, and also basically caused because of deletion 22q11.2, so catch-22 situation with poor immunity, and therefore recurrent infections can occur in this child. Okay, question 7. Dil tham ke baithiye. Answer fast to get more points. This is a 0 dose of this vaccine is considered up to 24 hours of birth, up to 72 hours of birth, up to 7 days, or up to 15 days of life. First, you have to identify what vaccine we've shown. It is seen on your phone. Please don't look into the screens. Can you see the VVM? Can you see the VVM? And which VVM is giving you a 0 dose? But 0 dose? That is called as the birth dose, ma'am. No, ma'am. This is for hepatitis B, we don't call it 0 dose. We call it as birth dose, and it is given within 24 hours of life. But this is a vial of OPV. It is even written poliomyelitis here. Dr. Manglani is saying it is very clear, and we follow her. And ultimately, it is the quiz master's decision.
Yeah. So the answer is already fed in. Even if you want to fight, people have got the points.
Okay, now this is up to 15 days. It's a 0 dose of OPV. Why is it called 0 dose? Because this is given as an extra dose given before your primary series. Whereas when we talk about hepatitis B at birth, the National Family Mission basically calls it as the birth dose and not the 0 dose, and it has to be given within 24 hours of life. Okay? So, having said that, we now go further. Who's this gentleman? All of us know him very well.
Mic's off.
Okay, now this is a chocolate question. Can we have, people ready? What is the disease that he suffered from? Raise your hands and you can give the answer. Very good. So this is Stephen Hawking, an English physicist who was diagnosed with a very early onset, slow progressing form of. Have you given chocolates to the ones who answered it as
हो गया, हो गया. Already done.
amyotrophic lateral sclerosis? He was actually given just about 2 years of life, but he survived till the ripe age of 78 and basically gave a lot of landmark inventions to us. So, and a big amount of inspiration also for people.
Incidentally, he has predicted the Earth to become a giant ball of fire by the year 2060 if we don't pull up our socks for environmental change.
So, अब दिल थाम के बैठिए क्योंकि स्कोर्स आ रहे हैं. And let us see how it goes further. So these jump of scores is coming because of fastest fingers, and we still have Dr. Aishwarya leading up. So a big round of applause for her, followed by Dr. Mugdha Ketkar and then Dr. Aditi. As we go further,
All right,
all ready?
coming up. So, see the EEG. I'm sure most of you all will recognize this. What is the first line of treatment for this? Phenytoin, ACTH, vigabatrin, ketogenic diet.
This child presented with infantile spasms
Yeah.
and also had some hypopigmented patches on his torso. Oof.
Lovely. So, chaotic asynchronous discharges, irregular spikes, infantile spasms, classical.
So this is hips
The-
arrhythmia.
hips
Considering you
arrhythmia.
had a queue of hypopigmented patches on the torso, we are dealing with tuberous sclerosis.
sclerosis.
And for the infantile spasms of tuberous sclerosis, the treatment of choice becomes vigabatrin, whereas for all other symptomatic West syndrome, we have as ACTH or prednisolone. So please read your questions very correctly. Next one. All ready to go?
So, this person is using a device. All of them are true about this device, except if reading is less than 70, you should recheck by a pinprick method. You should avoid vitamin C supplements while on this device. The sensor should be replaced every 30 days and must not be applied to hairy areas or any scar tissue. You will see more of these in the next couple of years, becoming pretty common now.
The time is up.
We are the capital of this disease now. So, this was a CGM sensor. It's the disposable one, so that's why you need to replace it every 7 to 14 days and not every 30 days. And all the other answers are correct. You'll see more and more. UK is already giving it free of cost to all its children who are diabetics.
So basically, vitamin C basically also affects the glucose oxidase pathway, and that basically is what we are picking up the
It
interstitial
interferes, yeah.
fluid glucose. So it interferes. You may get falsely raised levels of vitamin of your glucose. So that is why you can't. And the first one, if the reading is less than 70, it doesn't pick up hypoglycemia very well, and therefore one needs to be careful. And because it's picking up interstitial fluid, scar tissue is not allowed to be put into hairy areas because your sensor will not stick. The next one.
A 4-year-old is often seen in one of these postures. What is she most likely suffering from? Sydenham scoria, voiding dysfunction, vasovagal syncope, and cyanotic spells.
सब गुमराह कर रहे हैं एक दूसरे को नितिन शाह सर को सीरियसली ले रहे हैं सब लोग टाइम अप ओके आई थिंक
So that's voiding dysfunction. Also, हाँ? अभी वो है थोड़ा चालू है. You can reload it, sir.
So bowel bladder dysfunction, yeah. The next question here. Be ready.
So this 3-year-old girl with vision difficulties showed this on the eye examination. She was also tall for her age. The arm span was much longer. But what is the dreaded complication? Retinal detachment, scoliosis, bronchopneumonia, aortic dissection. Anyone who put the answers is ruining their chances. See?
So the correct
Whopping 50.
answer is aortic dissection. We are talking about the most dreaded complications. So retinal detachment also does occur, but of course you're most worried about impending death.
Famous people with this.
Identify?
Who's this?
अभी तो
What
इसको
does he
कौन
suffer?
भूल सकता
No, he's
है?
not suffering from orphans. He's not suffering.
टेस्ला वाले को क्या है? He has proclaimed
himself
it
has said it.
himself. Self-claimed. See?
Self-claimed.
Dr.
Samir
has said.
not to answer. बोल दिया तो आप आंसर कर दो.
No, no. So Asperger's
Asperger's.
disease is what he has. And so let's look at the quiz here. The leaderboard, the most awaited leaderboard. And now Aditi has surpassed everybody. One wrong answer and we've gone down. Okay. Be ready for the next question. A 5-year-old child presents with recurrent cough, snoring, and sleeping with the mouth open. What does this X-ray show? Is it a severe adenoid hypertrophy, a large epiglottis? Does it show the steeple sign or an enlarged palatine tonsil? I have that other one.
Correlate clinically.
Kindly correlate. Okay, here the correct answer is enlarged palatine tonsils. And before you pounce upon me, I would like to show you, this was a real picture, what we showed the X-ray. But this particular, look into your own phones, you'll get the correct thing. You can see a very enlarged palatine tonsil going down and almost touching the epiglottis, whereas the enlarged adenoids will be seen higher up in the nasopharynx. Okay, next one. In our win, so that means win bhi nahi dekha. Okay, the next question. Be ready. The mother of this newborn had no ANC visits or ultrasounds done after her first trimester. What genetic mutation causes this abnormality? FGFR3, CFTR5 is F508 deletion, SOX2 or CYP21A2. Mamta ma'am to chali gayi lunch lin. Oh, this is a real divided house. I want to clap.
Finally.
Okay, so this is basically FGFR deletion. This is a child showing achondroplasia or maybe the various mutations of the same. So basically this is FGFR gene is the one which provides you the instructions for making proteins that are involved in the formation of bone and brain tissue. So these are the patients who will come to you with basically a shortened limb. It's a commonest cause of short-limbed dwarfism, and we do see a lot of achondroplasics on the roads of Mumbai. Okay, some small facts before we look into the leaderboard. This is Miss South Africa, who was recently, as recent as Jan 2024, Mia Leroux, who was the first deaf woman, deaf at birth essentially, who was crowned Miss South Africa. She was diagnosed with a profound hearing loss at age 1 and underwent a cochlear implant to perceive sound. And she also underwent speech therapy. So essentially we are talking about hope and inclusivity, and therefore we are also talking about this first parliamentarian with Spain, Mar Galceran, who is basically a person with Down syndrome who's into the parliament. So more and more people coming into the mainstream is what we want as pediatricians also. Perfect, sir. Okay, so the leaderboard goes like this now. And let's see how it has upset. Woo! So Rupesh is coming first, followed by Azim, followed by Aditi. So buck up now. We have just the last few questions to go. Aishwarya is fifth at the moment.
Ready?
Let's play the 14th question.
MRI for 4-year-old with dystonia shows this classic sign. ADEM, pecan, neurocysticercosis, and Rett syndrome. Well, you may have heard something else before. So what was the old name? And the new one? Yes. So the eye of the tiger, the classical sign that is seen, you see the low signal around the globus pallidus because of the iron deposition. That's one of the differentials for iron deposition in the CNS. You need to rule out Wilson's. You cannot miss out Wilson's. Next.
Okay, look into your phones, friends, and answer fast to get more
This
points.
is fast, very fast.
Identify
investigation?
this investigation. You have lost your chance.
MLPA, microarray,
Arpita.
karyotype of fish. Don't say oh fish. No, rapid fire is very fast. Don't worry. So yes, the answer was disclosed. Fish remember, it's like searching for a book. You use it for specific chromosomal abnormalities. So you're looking at 13, 18, 21 trisomies or some X or some Y, only then. You cannot pull up small genetic mutations done on an emergency basis when you want the result within 48, 72 hours.
Until we get the scores.
So everyone knows this lady? Yes.
And she's the one who basically made cervical cancer vaccine easily acceptable to people.
All
And yes, the top scorers now are...
right, there's a big fight.
Okay, again, big fight between Rupesh,
Rupesh,
Aditi,
Aditi and
Azim,
Azim.
Aishwarya, Mugdha.
But don't worry,
Come
the
on,
next
buck up.
fight.
We have the last rapid fire coming in.
It
And
can-
now we won't be spending any more time. Further we'll go. Let's spice it up with a power play.
Very
And
fast.
have a rapid fire round. Look into your phones, friends, and answer fast again to get more points. All of the below are red flags for this condition, except ophthalmoplegia, proptosis, pain with eye movement, and lid edema.
This was a win spotter.
Again, so we are giving easier options also. Yes, the
Well
answer
done.
is lid edema. The next one. Answer fast to get more points. A 8-year-old boy comes with jaundice, behavioral changes, and tremors. The eye examination shows this. Name the inheritance of this disease. Autosomal recessive, autosomal dominant, X-linked recessive, X-linked dominant. Time up. Correct answer is autosomal recessive. Of course, we can't go wrong in this. KF ring Wilson's. The next one. Answer fast again to get more points. Identify this logo. World Down Syndrome Day, World Breastfeeding Week, Breastfeeding Promotion Network of India, and Cervical Cancer Awareness Month. Who came ko?
Be breastfeeding lakha hai.
The correct answer is World Breastfeeding Week. The next one. The question is, adverse effects of vaccination against this infection includes all except febrile seizures, aseptic meningitis, transient parotitis, or Guillain-Barré syndrome. The correct answer is Guillain-Barré syndrome. Febrile seizures can occur when you get fever after 5 to 7 days. Sir,
G
GBS.
GBS, no, not with mums. No, नहीं होता. Yeah.
Okay, so we have the expert give us the
Last
answer.
question.
The last one is,
Yeah, it's come.
you have got the question? Okay,
Abhi. Uh-oh. Sorry, yeah.
okay.
Ah, yeah.
Sorry, there was some.
Connective issue.
What is the most common cause of this finding out of the following? Black hairy tongue, Acanthosis nigricans, Gasara or Balkadu application, and pigmented fungiform papillae of the tongue. Absolutely correct, Gasara or
Yes.
Balkadu application.
The most common.
And score us now before we score you. This answer does not add into your score. So you will have 4 columns coming in, Theek Thak, Paisa Vasool, Let's Play It Again, and Full On Dhamal. Just type whatever, just click wherever you feel was appropriate.
We can see who's marked what.
And Amin ko piche milna
And
hai
then
unko.
prize, नहीं prize देना हमारे हाथ में. See it goes. See, it changed. It changed. People are changing that. See, the last column is falling.
Yeah, absolutely. Because Amin is going to give prizes. So let's. So most people
किसको
think
भी
it
vote
is
करो.
full on Dhamal. And then are you ready to see the final scores, friends? We have 3 prizes for the first 3 scorers. And the prizes will be given by our conference chair people. Dr. Nehal, please come on the stage. And Dr. Satish.
हाँ इधर.
हाँ है ना?
All right.
And the final result is Azim. Azim gets the
Wow.
first prize. The next one is Aditi. Aditi हमारे पीछा नहीं छोड़ती है. 3 prizes. So the first 3 scorers get the prize. Azim, please come ahead.
Is Azim here or online? Looks like
Only physical people here get a prize.
Yeah,
Azim,
people can
Aditi
see the
and
link.
Rupesh, please come here. Please come on the stage. Aditi. Online. Okay, so can we go to the next 3?
Yeah,
Dr. Nehal. Should we give prizes to the...
Aditi is here, no?
Aditi is not here. Who's Aditi?
Aditi, Rupesh. Yeah, Rupesh is here.
Okay, big round of applause for Dr. Rupesh.
Wait, she's here.
He was also the
She's here.
fastest.
Wait, she's here.
Doctor?
Aditi.
Dr. Aditi, come. Just a second.
Azim.
Dr. Rupesh is from Kurla. Please give a big round of applause. And a big round of applause to all the people who participated in this great snap quiz. Dr. Aditi. No, so you get only the top 10. We are being fair. We can't give the lowest score to anybody. Who is Azim?
Probably online.
So we'll... Okay, so we give it to Bela ma'am. Bela ma'am can come and take the prize. On behalf,
SRCC.
you can give it to him, ma'am.
SRCC wala. Azim Khan, SRCC.
Okay. So we can give the prize. So again, a big round of applause for Dr. Azim. And thank you. A special thanks to Dr. Tushar Manyar, who in spite of not being here today, he has helped us tremendously, right from the conception to helping us with all the slides, the way we should go about it, and without whom this quiz would not have been awesome. So thank you to Dr. Tushar Manyar for helping us with this quiz. Thank you so much. And thank you to this wonderful audience. And again, a big round of applause for the top 3 scorers.
Thank you, both the quiz masters and people those who have stayed around. I know how your gut feels. So, Dr. Sameer Dalwai.